Welcome. Welcome to today's topic, which is post-traumatic stress. My name is Dr. Vanessa Ruiz. I'm a naturopathic doctor who focuses on mental health issues, and I'm also a holistic nurse. I'm here today with Corinne Zaylat. She is a holistic nurse. She has founded Wholesome Health and Wellness, and she's also the creator of a Created Life documentary. So I'm going to be picking her brain about her experience with post-traumatic stress today. So post-traumatic stress is essentially when a person has been exposed to some kind of traumatic event. It could include some kind of injury, it can include some kind of sexual violence. And what's so difficult about it is that so many nurses are exposed to traumatic events in their day-to-day. And oftentimes we're just asked to kind of keep it going and kind of compartmentalize. But actually, in suppressing and compartmentalizing, while it's important to kind of function and be able to do your job, right? A lot of the time we don't end up unpacking it. It ends up accumulating, and then we end up having a whole host of issues. And these issues actually look like basically PTSD, where it contributes to the sense of burnout. We don't want to go into work. We have trouble focusing. We get triggered by certain events that we may not be sure where they're coming from. And our goal today is really to educate nurses about post-traumatic stress, going beyond what they consider like the DSM-5 criteria, because the DSM-5 criteria doesn't really speak to our experience as nurses. It doesn't really speak to our day-to-day. I remember when I was a first-year nurse and nobody talked about post-traumatic stress, and nobody really talked to me about grieving and what it's like to kind of unpack the day-to-day and these traumatic events. And what ended up happening was I ended up burning out. And also, I ended up having this experience, and I spoke about this earlier, where I had a patient who passed away, and it was a very traumatic event for me. And I learned about PTSD. I learned all, the criteria for it, but my experience didn't match that textbook. So I would wake up at night, seeing his face, dreaming about him. I struggled to go into work because I really wanted to avoid having that encounter. And I ended up compensating a lot. I really struggled also to leave my floor, because I'm like, oh my gosh, if I leave my floor, then what if something happens? Did I do everything correctly? And I was really trying to control my environment. And so really at the time, I've suffered from post-traumatic stress. And so I hope that today people who are watching can kind of take something from what we're saying and kind of assess their life, assess their experience, and see if it kind of matches with post-traumatic stress. At the very end, we're also going to talk about therapeutics and how to kind of come out of this cloud of post-traumatic stress, what can be helpful, what may have been successful, and so that you can have some hope that you're not going to be left without scars, and having that ability to also create, just as like Corinne is going to talk about, a life that is recovering from post-traumatic stress. Welcome, Pat. We're so happy to have you here. I just also want to share that everything is going to be recorded today. And so if you don't feel like sharing, or if you want to keep certain things private, don't share them, because this is also going to be on YouTube, and it's really just as a function to help other nurses in this really collective experience. And so without further ado, let's hand it over to Corinne. So Corinne, how did you get into post-traumatic stress? What was your experience?
So, I was kind of born into it, actually. I have, I would call it complex developmental trauma. I believe therapists call it complex developmental trauma as well, which is a little distinct from PTSD in that it's complex in nature. It's trauma that occurs repeatedly and at the hands of people that you love and trust and who are supposed to take care of you. So my environment was that my mom left when I was 1 year old, and I was raised by a raging alcoholic father who was very violent. I had gotten many beatings from him, beatings from my brother, sexually abused by a couple family members. From the time I was 8 years old to 15, I had experienced some of the sexual abuse and trauma. And so there's something called an ACE score, adverse childhood experiences. Some people might be aware of what that is, but there's 10 essentially what they measure trauma with, 10 different, my brain just went blank. So it's physical abuse, sexual abuse, mental emotional abuse, the two neglects, physical neglect, feeling like you won't have food, shelter, your basic needs aren't met, and then mental emotional neglect, feeling unloved, unwanted, and then the 5 domestic traumas, which is a parent that's absent, a parent with addiction or alcoholism, a parent with mental health issues, domestic violence, and then a parent that gets incarcerated. And so by the time I was 15 years old, I'd already had 9 out of the 10. And statistically speaking, what they found is people who had that kind of trauma generally don't make it. They're suicidal, they become drug addicts and alcoholics. I had so things started to really change for me when I was abducted by a convicted killer at the age of 14,
Wow.
and was, beaten and raped and then almost killed. And that was when the courts finally stepped into my household and said, they found my mom. They said she's not competent. They interviewed my dad. They said he's not competent, and they made me an orphan ward of the court. And so then from 15 to 18, I lived in foster homes and group homes, and then started the traditional cognitive behavioral therapy modalities. I did have one therapist, though, that I saw who I think was instrumental in things changing for me. And he was like a hypnotherapist, but he also got me started with Siddha yoga meditation and transcendental meditation. So at the age of 16, I had a Guru Mayad Kidvilsanananda, and I began meditation. And all of that helped calm my nervous system so that I could live in my body again, because I had the experience for the majority of my life of just not feeling comfortable in my own skin, literally just wanting to peel my skin off. It was just, you just carry it with you. So that was kind of the starting phase for healing for me, living in a group home, living in foster homes, doing meditation and things like that. And then it kind of sprung forward from there. I did cognitive behavioral therapy, dialectical behavioral therapy, EMDR, Gestalt, various different modalities over the years. And then I read a million self-help books. So, and just a lot of work, a lot of it really is my own personal work. Therapists can't do it for you. You really have to confront what it is that you're feeling inside and learn to exist in your body again with the trauma. And, that's a different level of what now I'm working, as a nurse, but I've worked in hospice and had patients die, and and that's another degree of trauma. So there's so many varying, degrees of trauma and experiences that we have that are traumatic. And one of the important things that I learned early on was it's really important not to compare your trauma to somebody else's trauma. I was in support groups for rape and incest and things like that, and I often found myself looking at girls that came from a cult, like a satanic cult trauma and multiple sexual abuses and things like that. And I thought, well, God, I don't even belong here. I'm not that bad, but you can't do that, because even if your traumatic experience, might have been one time isolated or something, it's still your personal experience. And it's important to honor that and to honor the process of healing and grieving and getting beyond that.
Yeah, yeah. One thing I want to touch back on is the whole idea of calming the nervous system. Because what people also don't realize is, your brain, when it's traumatized, it goes through a loop and it's kind of stuck in that loop. So it continuously perpetuates kind of the thoughts of that trauma over and over again until it gets reprocessed. And so it's almost like your brain is living in the past, living in as if the trauma was occurring every single day, every single moment. And that's also why you see a lot of that hypervigilance, like what's going on, what's happening. And a lot of people have like that startle response, which is a lot of the patients that I work with that have PTSD, they're like, just they hear something behind them, a pen dropping, and then they get startled because that nervous system is just so on edge, like sensory wise, hearing, seeing things. And so having to calm the nervous system is such an important aspect of recovering from post-traumatic stress. And, a lot of my patients that have PTSD, they have the trauma, their body stays in this like heightened state. Their nervous system is pretty much on this hyperstimulated state. And then and this is also something that nurses, need to recognize too, is that if there's not a quick intervention or an immediate intervention, then that can develop into chronic toxic stress, which overloads the body. And then ultimately, like over years and years of a heightened nervous system, you end up actually like your hormones are out of balance. You're not able to sleep anymore. You have nutritional issues and blood sugar issues because really that stress has been heightened for so long and the body's been trying to compensate for years. So having that immediate intervention, which is why it's also really important that when nurses recognize that they've experienced a trauma, that ultimately seek help as soon as possible. And I also want to touch on the fact that oftentimes like getting help sometimes looks like you almost have this dilemma, like, am I weak because I'm getting help, or I can just push through it? And that pushing through it kind of kicks the can further down the road. That immediate intervention is so helpful. I a couple of months ago, this is not in the nursing field, I was actually attacked by a pit bull. And it was traumatic for my brain. And it was, from somebody who studies and works with people with PTSD, like I could see my brain doing the exact thing. I was like, oh, it's going into a loop. It just keeps thinking about the pit bull. And I couldn't go to sleep because it was just in this loop. And I went to a therapist. I got EMDR within the first few days of it happening because I was like, I know exactly what this looks like. It's going to develop into PTSD if I don't act now. I went to a therapist. I also went to a chiropractor and acupuncturist just to help calm down my nervous system because I actually wasn't sleeping for several days after the accident. And so it was just really fascinating how my brain just automatically went into that loop. And having something kind of disrupt that loop right away. Go ahead, you're saying something?
It's so amazing that, that you knew and you had the skills and the knowledge that getting help immediately was really important, because I think the mistake that we make is, rumination is one of the things that creates that neuronal pathway to get hardwired in our brains. And if we don't disrupt that, then we ruminate and ruminate, and it just is what solidifies that. And so I think that's amazing, and it's really important for nurses. And also we do tend to be. I remember being in nursing school, we were so competitive, and we all wanted to be the best and be the smartest and get the straight A's, and and with that, like you said, we have a tendency to not want to appear weak, or we have to tough it out. And I actually just read, even with doctors, the statistics of medical professionals committing suicide is just incredible, you know, because we are health, we're wellness, we're the faces of what it is to be healthy and well. And our own needs are often, you know, I remember working 13-hour shifts and not having a bathroom break, you know, it's just things like that, you know, and we just got to tough it out because, you know, God forbid I go to the bathroom, you know, the 5 other nurses I'm working with are hating on me because how dare I, you know. So
Yeah, or
there's a lot to it.
and there's also like a sense of humor about it. Like, oh, I haven't peed in 12 hours. And you're like, yay. You know, there's like it's how much can we take, right? That kind of we wear kind of that badge of like, I've taken it so much and I pushed through and I'm really strong. But it's also really strong to ask for help. And it's also really strong to like, you know, recognize that there's something not quite right with how you've been functioning, and then to be able to get that kind of help. Pat, do you have anything that you want to share?
I think because of the publicness of it, I'm going to hold back a little bit.
Absolutely, absolutely.
But I agree though, in terms of uh, of the techniques that really work on your body are so
Yeah,
powerful. You know, that's the way.
absolutely.
That's our way through it because the mind can't um, deal with a lot of this stuff. I
Yeah,
mean, it does way, but especially when it's layered on layered, it just and the being supported through uh, breath work, visualizations, that sense of bringing the imagination into thinking of other ways of um, experiencing things, and just you know, I think it works both at the beginning of the process just to really calm the system down, you know, just really calming it down, and also uh, there's a part of when you're looking to really bring back meaning into your life that it also is really powerful.
Mm-hmm.
I love that you brought up meaning because it's
Yeah.
one of the ways that we can one of the ways that we can unpack our experience. It's a way to move through grieving. It's a way to move through trauma. Um, I've worked with patients about their narrative, like their story. And that's been kind of helpful for them to kind of reflect back in their own way about what's happened to them too. Because oftentimes, again, you don't really take inventory of what's happened. And you also don't, you know, when you find meaning in it, you can kind of come to this place of acceptance, right?
Yeah, or I think like expressive art therapy is great.
Mm-hmm.
You know, movement. You know, something like
Oh,
some of them just don't do as well with words.
Yeah.
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 You know, that we
Yeah.
just need some other kind of way of, because particularly if you, as you say, it's very complicated, that it's not one incident. You know, then a narrative might be like, you know,
Yeah.
like just so much.
Yeah. Well, I mean, it seems to be like a natural segue, but movement is just like, we'll talk about movement too, because um, movement is so important in recovery. Particularly what I've found to be helpful is yoga, just a lot of that breath work. I've also found things just like even walking and talking with your therapist. That's been really helpful. And oftentimes when you think about it, like when you're really upset, you go out for a walk. And that's primarily because you're processing, the right and the left side of your brain are starting to talk. So movement's been really helpful. And Corrine, you've done some movement, right? Like through and being able to process the trauma.
Yeah, I think there's a couple of things that have come up in my mind just now. Dr. Bessel van der Kolk actually talks about dance. And I know his book, The Body Keeps a Score, is like my Bible. But I became a break dancer when I was 16, 17, 18, and that became my art form. I just danced all the time. And it's funny because even before breakdancing at the age of 16, I would dance in the house a lot, you know, whenever I was sad. I was also a singer. I started singing opera when I was like 13, 14 years old, classically trained. That was very emotive. And it allowed me to express really deep pain and emotions that I didn't have access to in language, because a lot of it was trapped somatically. It was all in my right brain. Before the age of 6, you know, when you have trauma before the age of 6, it pretty much does reside in the right brain. And so creativity, you know, creative expression using that right brain and somatic experiences are, you know, some of the most healing. And so singing, dancing, poetry, all of that stuff. Dr. Bessel van der Kolk also mentions theater, role playing, things like, there's so many amazing creative expressions that really do help you get it out of your. I've also done rage work where I just hit a pillow and just open the rib cage up really high and hold a stick up over my head and then come down and visualize like the perpetrator. And that just released an incredible amount of toxic shame from my body. And it was all stuff that, you know, I could say it and intellectualize it, but it really didn't get to the root of it until I moved it somatically. And so I really do believe that movement is just incredibly powerful and necessary.
Yeah. I
I've taught prenatal. I teach prenatal yoga, not during this COVID thing right now, but I think that that's another, like, women that have had a traumatic births, you know, and then they're having a second child, so getting that out of their system. And I think
wow.
dance is beautiful for that too. You know, like, there's a whole thing about spiraling babies and just moving the body. You know, it's so beautiful for both of them.
Yeah.
That's
Well, and the epigenetic component. I mean, I think about, you know, when a mother's pregnant and the impact of trauma and stress on the genes of the infant, you know, and so you're processing that before the baby's born, which is powerful.
That's,
yeah.
yeah, there's some French guy. I don't know his name at the moment now. He's an obstetrician, and he was saying that basically for good birthing, you really want to drop the neocortex entirely. You know, that if you can really, that the safest births are easy births. And I think whether you're birthing anything, you know, the baby, a book, you know, or something, you know, like whatever you're about, you know, that there were times where you really want to use your brain in a certain kind of way, and other times where you really need to use other stuff.
Yeah.
Yeah.
When I work with my patients, I mean, a lot of the times they're like, well, a lot of my fears are not logical. And I'm like, yeah, actually, that makes sense because it's really the different, I call it the basement brain, and they seem to get it. Because if it was that easy, right, somebody would tell you to relax and you'd relax, right? But the part of the brain that is on and vigilant is actually not accessible by words. And it's actually accessible through sensory stimulation, which is essentially part of that movement. And it's accessible through experiencing. And, you know, you were talking about singing and, you know, doing opera. And one of the ways that we can tap into the parasympathetic is really through singing, right? Because when you're singing, you're using the vagus nerve, the nerve that is kind of the major nerve for the parasympathetic, rest, recover, digest. So a lot of the times, you know, I encourage my patients to do breath work because it's really grounding for them. You know, people who have PTSD, who have anxiety, but they don't realize, like, we've heard of this term called dissociation, right? And we think, oh, this, you know, you're having an out-of-body experience, but it's really being disconnected from the present moment and just being up in your head. And it's, you know, and you're just kind of thinking and thinking and thinking about, you know, the trauma, right? But it's a form of dissociation. Once you incorporate movement and somatic experiencing, then that person then feels safe being in their body. And ways to do that is through breath work. Breath work is really important because it's grounding to that person. It helps them to feel safe in their body. It helps them to feel safe in the present moment too, right? And it's also a great way to be able, because think about it, breath work, it's voluntary, like you can manipulate your breath, but it's also involuntary. So then you access that quote unquote basement brain. And so it's a really good way to be able to start kind of processing the issues in your tissues, right? Because people talk about muscle memory and they're like, yeah, tennis or walking and standing. But there's also traumatic muscle memory that needs to be unpacked through all these things that we're talking about.
Mm-hmm.
Yeah.
Yeah.
Yeah. I also want to talk about, oh, I'm sorry, Pat, you were going to say
No,
something?
what I was going to say is that if you have an asthmatic person, though, or that there's certain issues, or um, that breath work is not available for them, because that'll actually freak them out, like that it's but that there's always something. There's always and part of or moving around, like, but I think that it's just like, I think we often think of like the ocean as being like a relaxing thing, but for some people, that it's not relaxing, that
Yeah.
because of our experiences. So I think we have to uh, check in and find out what works for people.
Yeah, and the more tools that you have in your tool belt, the better that you can kind of match what's perfect for that person. There's no one size fits all. Although in nursing, we kind of think, okay, well, one pill for everybody.
Or 10 pills.
Oh yeah, 10 pills.
One
Yeah.
of the, I don't know if you're familiar with Pat, Dr. Peter Levine, but he has some excellent books on healing trauma, and I have listened to some of his tapes or his CDs where
years ago.
Yeah.
Sorry?
What's that? You heard him from years ago?
Yeah, Sounds True. And
Oh, yeah.
True, yeah.
What I love is that, he'll have you start with just touching your own hand, just becoming comfortable with just feeling your own hand, and then feeling your arm, and then moving up to the bicep, because a lot of times survivors of trauma, can't be in their own body. And so something just as simple as just feeling your own hand and being present to the sensation of your skin, and then moving up. And, that was just really powerful for me to learn that process. So I enjoyed that a lot.
Yeah, I had gone to take a workshop in trauma yoga. And it's interesting, there were maybe about 30 people, and they said, how many people, just feel like they're dealing with post-traumatic stress, and only one person didn't put their hand up. And I did not, that was the only workshop I didn't complete. And it was just, I was so triggered there. There was no, they didn't do breathing work or asanas, and it was very focused towards military trauma.
Wow.
Which I honor. There's so much, and it's so important, but you need to know where your entry is.
Mm-hmm.
And who, yeah.
Absolutely. So a lot of the times, and I also wanted to mention this because sometimes it's not a good idea to delve into the trauma. And, with some of my patients, it's like you kind of have to stabilize first because they're so dysregulated, and you have to find something where they can anchor to, and you stabilize them. They feel grounded, they feel secure in in the floor, right? Not like someone's trying to pull the rug underneath them. And then, when they're feeling safe, and really also with their consent, then you can start to slowly unpack it. And so, it's not always like the case, like to deal with a trauma. Sometimes like you kind of have to just let them feel grounded and stable.
Yeah.
So some of the therapeutics too, like I just wanted to touch on that, is something called eye movement desensitization reprocessing, which you talked about. And it was actually a treatment that I had after the pit bull accident, and also like earlier in my life. And I found that to be extremely helpful, because I could tell my brain was starting to process these things. And essentially, what it is, for those people that don't know, there's usually some kind of bilateral stimulation involved. It's either with the eyes, where the eyes move back and forth, and it's meant to kind of replicate what happens naturally when you're sleeping, is that your brain starts to archive and process these memories. And it also creates more insight, and it allows the left and right side of the brain to start talking with one another. And so there's more of a communication between them. And the right and left side, they each have different characteristics. One is more logical and one is more emotional. And if you can have a balance and blend between that, then you can kind of access their different characteristics to help you kind of with the trauma. The other ones that have been helpful: desensitization therapy. This is when you're gradually exposed to whatever that trigger is. And I've found that also to be helpful as well, especially, like, for example, if it's a very clear type of trauma and the patient is still safe when being exposed to it. And there are certain therapists that will do this kind of work. And then there's also, you mentioned cognitive behavioral therapy, which is essentially using their cognition to help them through the trauma, and of helping them to reframe certain things like cognitive distortions, which is when you don't see the situation because you're kind of seeing it in a different way. Then there's also somatic re-experiencing, and that's something that you've gone through, right, Corinne?
Yeah, a little bit of somatic experience, more EMDR. But I know that there are therapists out there who are actually certified in somatic therapy. But when I lived in Sedona, I did something called the event. And they utilized a lot of sort of somatic stuff, but I don't think that they were really certified in somatic experience. But it happened to be something, and that was in the early 90s, and it happened to be something that was, it was a group scenario. There were about 30 people in the room, and, we would go through this whole process of calling people out on their act and doing the demand and things like that. But the somatic part of it was, finding somebody in the room. It was role playing. Finding someone in the room who reminded me of the people that violated me. They'd hold my hands behind my back, and I had to use my voice to, say, no, it's not okay. And so I learned about the drama triangle: persecutor, victim, rescuer, and I learned how to make a boundary and say, no, that's not okay. But when I used to say, no, that's not okay, it would come out as that scared little girl, and my knees would buckle, and I wanted to curl up into a ball and disappear, because I was still, that 5-year-old scared little girl inside. And so the distinction that I got in my body that was very, very somatic was standing upright and owning my voice from a deeper place, a place that when I said it, it came out with power and meaning. And so it landed in a way that people actually heard it and honored it. And so there was a huge distinction and it was so visceral that I literally walked out of that training feeling empowered and feeling like, a woman whose voice was heard, and I, could command something, in terms of respect and boundaries, and it would be honored. Whereas before I was just very meek and very scared and timid. So it was a really big distinction to make in terms of, and that's probably the closest to a somatic setting that I'd been in.
Mm-hmm.
But I'd like to do more with Peter Levine in particular and experience some of his work.
Yeah. I wanted to address one of the things that you had mentioned, is that experience of kind of feeling like you're meek. And, people handle stress so differently. And it's not just one person experiences this kind of stress. They kind of go through this spectrum. And so when people handle stress, we've heard of the fight, flight, freeze response, and then there's also fawning, which is kind of the new response. And I'll go through those different kinds of um,
Is that like helplessness?
well,
Or
it's essentially when there's someone dominating, you feel stressed out, and then you kind of end up kind of fawning, basically, like kind of being submissive and subservient.
mm,
And it's interesting because I think that I see a lot of that fawning in some of my patients, right? But just for those who don't know, the fight, flight, freeze, and fawning response. Fight is basically your body gets ready to fight something, and so essentially your brain, you get that tunnel vision, right? Your blood sugar will actually spike up, your blood pressure will spike up also, your heart races, your lungs start to bronchodilate, you stop digesting, you decrease the blood flow to your reproductive organs, because at this point you're going to fight something. It's not time to be romantic, right? And then all the blood starts to run to the musculoskeletal system, all ready for you to fight something. Also, to run away, your blood sugar has to spike because your body has to have enough energy to be able to maintain that state, right? The freeze response, this is something that I see often in people with PTSD. It's essentially like the emotion and the trauma just gets stuck. And then a lot of that looping then starts to occur. And so for those patients, the somatic experiencing is so important, because then it kind of gets them out of that their body, and also it helps them to feel empowered, in a sense of like, if you've been attacked and you just freeze, then there isn't that outlet to necessarily to defend yourself, to be able to reciprocate, or to be able to fight back. And so that experience can sometimes be helpful for the right person to experience that sense of empowerment. Otherwise, it does get stuck in their system. And so I talked about fawning earlier too, where it's kind of that same, like, needing to feel empowered. And here's the thing about trauma and recovering. It may have happened in the past, but if that person experiences that in the present, it's healing. It's incredibly healing. And so for you, it sounds to me like when you were having the rage, right? You were essentially kind of moving out of that freeze zone and getting into a place of empowerment. So that's so important. So important.
yeah, and I had experienced a lot of freezing. Now with my family, I tend, as a 12, 13, 14-year-old girl, I would fight back, as best I could against a brother and a dad. But with the convicted killer who abducted me, I froze. Like he had me by the throat and a gun, and there was nothing I could do. And so I froze. But then when he was done assaulting me, I did find an opportunity to run, and ran and broke free, and got away and survived. But I've read that, and I think it was in Peter Levine's work, where he said, when we do, there's also Dr. Bessel van der Kolk talked about, dogs in cages, and they get shocked, and then they have the learned helplessness, and so I read that it was that reprocessing. It was, Peter Levine calls it discharging that emotional energy that gets trapped in the body. And by doing that, your body relearns to move, like the dogs, where they would shock the dogs and the dogs would be in the cages, and then they would open the cage door, but the dogs had learned helplessness. And I had that too. Like most of my life, I felt like a victim of the whole world, because I had learned it from birth to 16, 17 years old.
You don't have a choice. You don't have any control whatsoever. So what's really the point is kind of the mindset behind it.
Yeah, and they had to drag the dog out of the cage over and over and over again to get the dog to finally realize that it could be free, that it could go run and be free again. And that was the experience that I had. I had to drag myself out of, that mental cage, that mental prison, over and over and over. And, still, even today, there are times, if with a job, and I might have a boss that feels very overbearing and, mean, and I'll start to feel that shift in my energy. My body will start to feel, I had a boss come up and literally stick her finger in my face and yell at me one time. And I had so many knots in my neck and in my back because I internalized it and I held it, embraced, I'm like, I'm a nurse, I'm a professional, I have to, stay with this and be professional. But it took me about 3 days of massage therapy and warm baths and yoga and all kinds of things to release that from my body. And so I think, if we bring this back to how we are in the medical world, it's really important for us to stay cognizant of, how important it is for us to honor ourselves while we're honoring our patients, while we're honoring the demands of our jobs. I just feel like it's so important for us to have very, very diligent self-care practices.
Yeah. And oftentimes people think it's either or, right? It's either my patient or me. It's either I go to the bathroom or I spend 5 more minutes with my patient. But it's really incorporating yourself as being just as important as that patient. And in a way of seeing it like, if I'm not taking care of myself, there's no way I could be present to anyone else. There's absolutely no way. Like if I don't eat lunch,
Mhm.
I won't actually be able to focus, concentrate. I probably will be very hangry, so I'm going to be irritable towards my patient. It's kind of as simple as that, right?
Yeah, I used to get really bad low blood sugar. It was interesting we were talking about the blood sugar issue because, I had chronic hypoglycemia. And then, of course, I learned in nursing that can flip into diabetes because you get beta cell burnout with pancreas. And so, it's all connected. My biology and physiology was being programmed with, and that's what ACEs points to, is diseases later on in adulthood.
Yeah.
And it's that chronic. And Bessel van der Kolk also talks about studies where the cortisol, they thought people who had chronic stress, that the cortisol would shut down. And what they found is that it never shut down. It was always high, even when, the stress response. So that loop never really turns off. And so, yeah, so just even having to recognize I'm at work, I'm starving, my blood sugar is getting low. I know that I have, 4 patients to still go get vitals on, but I'm going to, at least drink a protein shake and get something in me so that I can, not pass out on my patients and, still take care of my own well-being.
Yeah. And I kind of want to go back to the cortisol because there's something they call HPA axis dysfunction, which is when your endocrine system isn't responsive really anymore to. So essentially, first, after the chronic toxic stress, you've got all these high cortisol levels. And that opens it up to having cortisol imbalance because it's supposed to rise in the morning and then it's supposed to slowly go down during the day, during the night so that you can fall asleep. But a lot of my patients, what ends up happening is they've had this chronic toxic stress and that cortisol has been high for years and years and years and years. And then eventually it's kind of like diabetes. The organs don't respond as well to cortisol. And so eventually what ends up happening is you have to create more cortisol. And then eventually the organs, they don't respond as well. And they also don't produce cortisol as efficiently, or it's completely out of whack where instead of rising in the morning, it starts to rise between 12 to 3. And that's when you start to see more of that insomnia picture. And so, yeah, there's that, that kind of that toxic stress that, you were talking about the mind and the body. And oftentimes, when I see a patient come like that, I got to address the body first because they're not sleeping, their blood sugars are out of whack, their blood pressure is so high. And then I can kind of address more of the mind stuff. But really, they're all so interconnected. The mind, body, there's no separation whatsoever.
Yeah.
I wanted to kind of segue into, we've been talking about trauma, we've been talking about some of the therapeutics, we've been talking about the physiology, and you recently created a documentary about your experience called A Created Life. Tell me about that process, and tell me about, because one of the things that you wanted to share was really, your recovery and your healing process. So tell us about that.
Okay. So the film is on Amazon and Walmart and Best Buy and Barnes and Noble. But it's called A Created Life, A Journey to Empowerment is the full title. And I decided in 2013, I was doing some courses at Landmark Worldwide Education, and their personal growth and development courses. So, I'm a firm believer in just continuing to evolve as a person, being the better me tomorrow than I was today, and just keeping that process alive and going. So I just keep taking various different courses here and there. And this one was a self-expression leadership program. And it was about, creating a project where I had to enroll people to help me so that I could learn to team build and be a leader and things like that. And I decided that I am a stand, my commitment for who I am in the world and how I show up in the world for others is to hold space and to assist people in healing from their trauma so that they can experience what it's like to shed that and to live life free of that and to experience peace of mind. For me, it took a long time to get to that point in life, and I'm very aware of the struggle of, I just read an article an hour ago about a girl who was raped at 14 and committed suicide at 23, and they just did a documentary on her life as well. The struggle of getting past some of these traumatic experiences. And I believe that, I lost faith and hope many, many, many times in my life. And I thought, there's no way I'm ever going to be happy or know what it's like to just be okay in my body. But I found that with doing all of the work that I had done and finally getting free of that and finally having peace to the extent where I stopped having nightmares, because I distinctly remember waking up one day and I was like, gosh, I hadn't had a nightmare in about a week or two. That was very unusual for me. And the fact that I was even aware that I stopped having nightmares is like, holy cow, what a burden that I'd been carrying my whole life and didn't even realize how abnormal that was until it was gone. And so my commitment is to show people and help people with coaching get to that place in life where they can let that go. And so I decided to go back and confront the people that abused me, and not in a confrontational way, but in a healing, forgiving way. And I went back and forgave my family. And then I filmed myself forgiving the convicted killer who abducted me when I was 14.
Wow.
He was in prison from 1984 until he was released in 2010, I found out, back in my home state in Wisconsin. And so in 2013, I decided to go and grabbed a camera and had somebody hold the camera. I decided to knock on his door unannounced and talk to him. I just said, would you like to have a conversation about forgiveness? And, he was sentenced to 48 years, but he did 26 years in prison. His sentence was as long as it was, I believe, because he had murdered several people in the Philippines before and spent time in prison in the Philippines, and then was released and deported and sent to the U.S. on parole. And so he was sentenced to 48 years, but did 26. So here I am knocking on his door, and he instantly recalled who I was and, just was shocked, dazed, confused. He was reeling. He did the interview with me. He did become a bit concerned about, doing it. So if you watch the film, you'll see the conversation I had with him, and he's kind of trying to hide off in the corner. but the conversation was, for me, it was really empowering because I got to see him, as his equal in some ways now, because rather than being the scared, meek, 14-year-old little girl, I was now, a 40-something adult woman, and I was on equal footing, and I knew I wasn't going to get hurt. Well, I didn't know, but, I knew. It was funny because I had that moment where he was like, come in, and I looked at the threshold on the door and thought to myself, the last time, I was anywhere near this person, I was almost murdered.
Yeah,
So
very brave.
there was that moment of like, oh, but I also had a plainclothes police officer with me and a camera guy with me. So I was relatively sure that, and, it was going to be okay. And so yeah, we had the conversation around forgiveness, and he was very appreciative. I did start to hear him twisting. He had a very distorted view of the experience, and and I started to realize he's probably not very mentally healthy. It probably, a sociopath, a psychopath. And, my words and my attention, my intention behind it may not really get through to him completely, like in the way that it would for me. But I was okay with that. When he started to distort things, I just said, okay, well, it's time for me to go. I just want you to know that I forgive you. I hope you forgive yourself, and I hope that you can heal whatever it is that's inside of you that has you, in the past do those things. And then I just walked out. So it was very powerful. I journaled quite a bit about it. But what was more powerful was the conversations with my family. And I thought about that a lot, and I realized that it's because my experience with him, though, although it almost led to my death, I survived it, and it was, one evening. Whereas with my family, it was, literally from birth to age 15. And it was repeated day in, day out, day in, day out, you're not worthy, you're not lovable, all of these things. And so it was a really different experience for me to, generate enough generosity within myself and to become a bigger person than that little girl who'd been so wounded, and to step into being the bigger person and saying, look, things didn't go very well growing up, and there were a lot of wounds. And, to my mom who left, I was like, I want you to know, not only, I'm not saying, I forgive you, because I've said that before to her, but it was more this, will you forgive me? Because I've spent my life, 40 some years, resenting you and hating you and pretending to forgive you and not really forgiving you. And the minute I spoke those words, will you forgive me? I felt myself, something shifted inside of me that just, I had to be a bigger person in order to say those words and in order to embody that. And then forgiving my dad and my brother also were just incredibly powerful. So yeah, that's the gist of the movie, but it's also about the healing journey. So it kind of starts off talking about, this is where I'm starting from. I've had all these years of trauma. This is what ACEs is. So I have 8 different experts, Vanessa's being one of the experts in the movie, who speak to the various different components of healing and different modalities. I have somebody who knows EMDR therapy, somebody who does energy psychology, somebody who also Dr. Allison Jackson she's done TED Talks, but she knows a lot about ACEs. So she did a lot around ACEs, which was really thorough. Also Dr. Nelson, who talks about energy work, and he has a book and a program called The Emotion Code and The Body Code. Very good programs. So I had a lot of different, and then Landmark person, Heather. And I just wanted to address that so that people understood that there's so many different ways to approach healing from trauma. It's such a holistic, because it is body, mind, and spirit. It's not just sitting down on the couch. I spent years sitting on the couch and talking, and although it helped me intellectualize, it didn't really help me heal in the way that I needed to heal, to be whole and complete. And so it really did take doing all of the different, I spent years in Sedona. I did energy work and chakras and yoga and meditation, and so I wanted to make sure that people understand it's a journey. It takes time to love yourself and be gentle with yourself, but also to realize that you can move around, you can do various different modalities to get yourself to where you need to go. The important thing is just to stay with it and to keep it going.
And to really see it as a hero's journey.
Yeah.
Yes.
It's not, it's what it is.
And you're your own hero. I mean, that's the thing. You have to be your own advocate and be your own shiro, for women. And, yeah, it's beautiful. And I think that if we approach it like it is a journey, and we are, throw on our cape, and I'm going to champion myself. I'm going to be my hero for myself, so that I can love myself, and I can demand, that I have a safe space. And, it's not demanding necessarily externally, it's demanding it of myself and of my space, that, I am allowed to be safe and free and happy. It's our God-given right, to feel that in this world and not live in fear and terror,
Well said. Well said. I love what you were saying about, kind of moving through all these different therapies, because, at one point during your healing process, you did CBT, and then another point in your healing process, you did more of the somatic things. And, that's kind of where the journey is, right? At some point you probably needed the CBT, and then another point you wanted to evolve and kind of dig deeper into the trauma. And so, really it's not one size fits all. It really moves back and forth. So thank you so much for this amazing conversation on trauma, and also just on recovery, because, we can get stuck on what's happened, but if we do, we end up kind of missing on the possibilities of the future. And also that, this is a community, this is a collective thing, that trauma happens to so many people. It's not just the people that go to, that are in the military. It's really a lot of us who may not have good coping skills. And, we get traumatized and we don't have the ability to be able to rise from it, whether we were children or whether we're nurses. And so trauma is really common. It's not, it's not just when you go to war. It's really a lot of people in our lives have been traumatized. So thank you all so much for this conversation. Next week, I'm going to be joining with mindful nurses, and I'm going to be talking about raising resiliency during the pandemic. So if you guys can tune in, it's going to be on Wednesday, and I'm going to put the link out on the email campaign that I send. So thank you all very much. Thank you, Corinne.
Thank you.
And again, her documentary is called A Created Life, A Journey to Empowerment. So thank you.
Thank you.
Thank you, Ted.